So I am effectively now going to do a bit of a walkthrough, I guess, of the core guidelines, trying to highlight some key points from those and also trying to address as many of the questions that we've received in advance as well. I guess before I go any further, I would just say, please do read the guidelines before you develop your proposal. There's a lot of information in them related to sort of eligibility criteria, what we're looking for, the application process. So please take a look at them in detail. This will just be a bit of a sort of overview of what's in there and what's to expect. So again, this will overlap a little bit with what Sue and Sanjay have already spoken about, but in terms of the interventions and the programs of work that are eligible and we're looking to support. So proposals can focus on one intervention or multiple interventions, and we don't have a preference either way. As has already been said, they must have robust evidence of effectiveness, and you'll need to make the case that they are ready to be implemented in practice at greater scale. And again, hopefully, as has been made clear, what we're really looking for is proposals which, with the aim of facilitating the longer term or the more widespread adoption of the intervention. And again, just highlighting the point that's already been made and which goes back to the question that was asked, these are interventions that could be adopted in a variety of settings. So we're not just limiting this to interventions that can be adopted in or commissioned in the NHS, for example. So these could be adopted in community settings by third sector or private organisations, local authorities, etc. The work that you're proposing needs to take place within the UK, but otherwise we aren't targeting any specific geographic regions. And as I think Sanjay has already mentioned, we will expect proposals to align with our key values for research. So we'll be asking about how you're addressing issues such as equity, diversity and inclusion, patient care and public involvement and engagement, and capacity building and career development, not just for the lead applicant, but for the wider team as well. And in the guidelines, we do list a few things that we are not looking to support, and I thought it might just be worth highlighting some of these now. So hopefully, as has already been made clear, this is not for the development of new interventions or for evaluating interventions that don't already have a robust evidence base. We're not looking to support proposals focused on pharmacological or drug treatments, clinical trials, and specifically focused on cancer patients. And we are open to other patient groups as long as overall the proposal is targeted at older, underserved communities. We're not looking to support the distribution or evaluation of standalone healthcare technologies or aids that aren't being delivered as part of a sort of wider service or program. And we're not looking to support postdoctoral fellowships or PhD studentships. So these are not designed to be personal awards, given the kind of scale and complexity of what we're looking to fund. These are team-based projects. We've had a few questions around who can apply. So the lead applicant needs to be based at a UK university, another eligible research organisation, and the link to the full list is in the guidelines, but that can include NHS bodies with research capacity. And we are also open to considering lead applicants from local authorities, in which case you'll need to make the case that there is a suitable research capacity in place. And as Sue has mentioned, we'd then also expect researchers from partnering universities to be within the wider team. We do welcome applications from more early career researchers, but again, if that's the case, we would expect more senior members to be in the team, and we'd like to see really clear plans for the support and mentorship of the lead applicant, again, given the sort of complexity and the scale of the projects that we're expecting to be proposed. You can only be the lead applicant on one application to the call. And just an important point, if you're currently the lead applicant on a grant from us or a co-applicant on more than 2 grants from us, then you might not be eligible to apply. So please get in touch with us if you're not sure or you want to clarify that point. As Sue has already said, there must be at least one adopter partner within the team. And we've already given lots of examples, but basically what we mean by a adopter partner is an organisation that's going to support the implementation of the intervention during the work and could be in a position to adopt it longer term at the end of the work. So please make it clear who they are and their involvement in both the development of the proposal and also in the work itself. And again, we also expect to see those with relevant expertise to look at the sort of financial sustainability and implementation implications of the intervention as well within the team. Other than that, we are trying to be flexible as to who can be involved. So we very much encourage co-applicants and collaborators both from within and beyond academia. So that could include people with lived experience relevant to the proposal, people from health and social care providers, people from community organisations, industry partners, etc. And we will also accept international collaborators as long as those can be justified. And I think, again, going back to something that Sanjay mentioned, it's not just about who's in the team, it's also about making it as clear as possible what their specific roles will be, the amount of time that they're going to be committing to the work. The more detail you can provide on that, I would say, the easier it will be for those who are reviewing your application. Eligible budget and costs, people always want to know about this. So we've allocated £2.5 million to the call, and you can apply for up to 1.2 million for up to 4 years. We might have a bit of flexibility around the overall budget, but in general, we are expecting to fund, a relatively small number of fairly sizable awards. So we're expecting that most proposals will cost at least £500,000. We do welcome part funding or in-kind support from other sources, and you'll have the chance to outline that in your full application if you reach that stage, but this isn't expected, it's not mandatory. There are lots of details in the guidelines about eligible costs, so I don't want to do a blow-by-blow account, but I will pick out some key points. So broadly, we'll fund the direct costs and some of the directly allocated costs of the work for research organisations. We won't cover the indirect overhead costs for research organisations, and that's because they receive a contribution to these costs through the Charity Research Support Fund. But if there are community partners involved in the work, then we would expect their contribution to be covered at their full economic cost. So that includes a contribution to overheads. And in general, we appreciate that with work of this nature, there are costs involved in setting up, implementing and running the intervention for the period of support. So broadly, we will support those costs. So that includes things like materials and consumables to implement the intervention. If you need backfill costs for staff at partnering health and social care organisations, those are eligible too. And as you can see, we're definitely supportive of justified costs that align with our key values for research. Again, what I would say is please read the guidelines in full. And if you have sort of specific questions about eligible costs, then it's probably easier to email us separately, and we'll look at those and get back to you as soon as possible. This is an overview of the application process. So this is a two-stage funding call. The expression of interest stage is open. It opened on Monday with a deadline of the 1st of July. And I'll go into a bit more detail about that stage on the next slide, my final slide. If you're successful at the expression of interest stage, then you'll be invited to submit a full application. And we aim to let you know either way in the first week of September. And the deadline for the full application stage will then be the 17th of October. We do also hope to make a PDF of the full application form available before that stage opens as well, just to help you with your planning ahead of time. Full applications are then going to be, they're going to undergo external peer review, following which you'll have a week in December to respond to the key points of reviewer feedback. Hopefully everyone will then have a nice break over the festive period and everyone will come back relaxed and rejuvenated in January. And at that point, the applications will be reviewed by an expert panel, and that will consist of external experts and relevant members of our research grant committee. And that panel will then meet in early February to discuss and consider all of the applications and make recommendations for funding. Now, if, and it is an if, the expert panel consider it necessary, then we've blocked out these 2 dates, 25th and 26th of February next year, for interviews. We've had a couple of questions about the interview, so I just wanted to clarify some things. So our preference would be for these to take place in person, likely at our office here in central London, but we will accommodate online attendance if needed. And in terms of who needs to be there, we obviously don't expect the entire team to come along to these interviews, but we would ideally like to see sort of the key members of the team who can speak to the different aspects of the proposal. So as far as possible, if the key members of the team can keep those dates free, that would be great. And regardless of whether the interviews take place or not, we aim to inform everyone who submitted a full application of the outcome by early April next year. And we're not then particularly strict around when the funded programme should start. We typically ask that they start within 12 months of the grant offer letter being sent. But obviously, if there's any conditions attached to the award, then you won't be able to get going until those have been met. So we're probably looking around summer, autumn next year at the earliest for these programmes to really kick off. Finally, just a bit more detail on the expression of interest stage. Like I said, the deadline for this is on the 1st of July. You'll be required to submit a written application via our online grants portal. We have made a PDF template of the application form online, and you can also get it at this QR code if you're interested. This is only for planning purposes. I just want to clarify that. So we will only accept applications through the grants portal that have been submitted by the deadline. This is just an outline of what you'll be asked to tell us about, basically, in the application form. So we want to know about the background to the work, so the importance of the issue or the problem that you're looking to address, and how it aligns with the funding call. We want to know about the intervention, how it was developed, who was involved, its key components, and obviously, really importantly, its existing evidence of effectiveness. We want to know an overview of the work that you propose to do, and this includes how you're going to be engaging with the underserved community or communities that you're looking to work with. Very importantly, and going back to what James was talking about, how this work will hopefully facilitate the longer term or more widespread adoption of the intervention. And we also want to know who's doing the work and their suitability as well. And those applications will then be assessed by a panel of relevant members of our Research Grants Committee. The assessment criteria are outlined in the call guidelines, but they very much align with the information in those bullet points. So you'll be glad to hear that the information that we're asking you to give us is the information that you're going to be assessed on. And like I said, if you're successful, you'll be invited to submit a full application, and we'll let you know in early September. Just a quick point on feedback at this stage. We aim to provide specific feedback to those who are invited to the full application stage, and then to provide general feedback for those who are unsuccessful. I think the number of people in this webinar is testament to the fact there's a lot of interest in this call. We're expecting quite a large number of applications. So we likely won't be in a position to provide specific feedback to everybody at the expression of interest stage. We wanted to be upfront about that now. That was, like I said, a fairly quick overview of the guidelines. Like I said, please do read them in full before you go any further in developing a proposal, but we now have a good amount of time to go over some of the questions that we haven't addressed that were submitted in advance, and also any new questions that you have as well. So I will stop sharing my screen again, and I'll pass over to Pedro to get us going.
Hello, and thank you all of you for providing questions and registering and in the chat box. So please continue to do so. And we try to cover as much as possible. And we'll, as Alice said, we'll start with some of the questions that were pre-submitted. So we'll start with one, and that: what outcomes are you expecting to be measured for this call? For example, how will you expect us to prove or evaluate if the project was successful? And maybe Sue can take this on.
Yeah, sorry. Sorry, I'm just trying to do two things at once there, which is never a good idea, is it, on a live webinar? Answering questions in the chat. So looking at the sort of outcomes we're looking to be measured, we're not being prescriptive about this. It would obviously need to be specific to the context of your idea, intervention, program of work. Fundamentally, we're looking for proposals that generate the evidence needed to help facilitate the intervention or services longer term adoption. What's essential is that your proposal clearly outlines how it will generate actionable evidence around social or health outcomes, particularly for older adults and underserved communities. The economic impact, so the cost effectiveness, the return on investment, the commissioning value, the sorts of things that James talked about. The implementation challenges and how they're overcome. And then longer term sustainability. So how could the intervention be integrated or adopted long term by partners? As we've also said, your plans should be developed collaboratively with those with the relevant expertise and those who would commission or adopt the intervention after the funding ends. And we've talked about who those might include. So does that address that, Pedro?
Thank you. And I think one of the other questions we submitted, are you only interested in medical related interventions or are community-based also relevant? Maybe Ollie, you take this one?
Yeah, I think hopefully we've sort of covered it, but we're not only interested in medical interventions, so community-based interventions would absolutely be eligible as well.
Thank you. So, how broad is the scope of prevention in underserved communities as a requirement for the call? Maybe Sue can again take this one.
Yeah. The proposal has to describe how the intervention could directly prevent, delay, or reduce health and or social care requirements for older adults and underserved communities. So, as we mentioned earlier, we've included a number of highlight notices within the core guidelines, and we're going to be looking to prioritise applications focused on these specific topics at the expression of interest stage. We've already provided some examples of what could be considered an underserved community, but it will be up to you to articulate and evidence why the communities you are planning to work with are underserved in the context of the work you're proposing. Because actually there will be some segments of communities in your particular locality or area that, because of the nature of, priorities with providers, are underserved. But of course there are sort of, the underserved communities that we typically see. Ethnic minorities, the LGBTQ community, or, well, we've already heard the CMO's remarks on coastal and rural communities. So they're the sort of big boxes, but, we do accept that there might be some more nuanced cases as well to consider. Any more?
No, I think it covers, thank you. And what is our definition of interventions? Maybe Sanjay?
Yeah, thank you, Pedro. I guess interventions can be structured activities, services, or programs that are aimed at directly preventing, delaying, or reducing health and or social care requirements. So these interventions should be evidence-based, meaning they are supported by research indicating their effectiveness in achieving the desired outcome. So I would like to think that it's quite broad, but obviously the key message there is the evidence base behind them.
Thank you. And I think now more specific to the expression of interest stage and how much information financially is expected at the expression of interest stage.
Yeah, I can do that one. So at the expression of interest stage, you're not going to be asked to provide a detailed budget. You will be asked to provide a sort of approximate value of the amount that you think you'll be requesting from us, and that's primarily just to help the panel understand the sort of scope and ambition of what you're looking to do. If you are invited to the full application stage, then you will be asked to provide a detailed budget that will be phased annually, along with a sort of a detailed justification of the costs that you're requesting. And you'll also have the opportunity to detail any funding or in-kind support from other sources as well. So it's relatively light touch at the expression of interest stage. It's just to give us a sense of what you feel you'll be asking for.
Thank you. And do the interventions have to be based in the UK, or as we have evidence from successful pilots in other countries? Maybe Sanjay can take this one.
Yeah, I can take this. Thank you. So the work, as Ollie has mentioned already, the work being proposed for this call must take place within the UK. So your proposal must clearly demonstrate that the intervention has robust evidence of effectiveness, is relevant and transferable to a UK context, particularly in relation to older adults in underserved communities. So this includes a strong rationale for why the intervention is appropriate for implementation within the UK and consideration of contextual factors such as population needs and the regulatory environment. So the short answer would have been yes, but I thought I'd provide some of that additional context.
Thank you. And does the intervention have to be previously researched by the lead applicant or current team? Ollie?
Yeah, I can do that. So it would be desirable, but not necessary for the lead applicant or the wider team to have been involved in sort of the development of the intervention or previous research around it. If that's not the case, then we would expect to see either sort of close links or collaborations with the team that developed the intervention initially, or sort of evidence that within the current team there's the sort of requisite expertise and the permission to sort of implement or adapt or use the intervention. And regardless of which is the case, within the expression of interest form, when we ask you to sort of describe the intervention, one of the things we want you to tell us about is how it was developed and who was involved in the initial development and also in the previous research around the intervention.
Thank you. And another question. Maybe yes, is measuring reduced health and social care requirements essential in the call, or can they be achieved by proxy measures? And furthermore, may the application address health or social care requirements for older adults in underserved communities rather than both? Maybe Ollie?
Yeah, I'll actually take the second part first because I think it's simpler. So yes, it can be, you can be looking at either health or social care. We're not expecting applications to sort of address both of those aspects, although they could, obviously. On the point around proxy measures, I think in general that would be acceptable as long as there's a clear link between those proxy measures and sort of relevant real world outcomes, whether those be sort of health and well-being outcomes for older people, or there'll be outcomes around preventing, reducing, delaying health and social care requirements. And also, obviously, going back to the discussion of James, whatever measures you use need to be relevant and meaningful to the partners that you are working with. So ultimately, it will be up to you to make the case that the measures you're proposing are relevant to the work that you are looking to do and can help to facilitate the longer term adoption of the intervention.
Thank you. And again, more about the evidence base. What elements of research or evidence are needed and how much detail is required? In addition, what level of previous implementation is expected to be eligible for the call? Maybe Sanjay?
Yeah, I can take this. Thanks, Francis. So fundamentally, as has hopefully been made clear, this is not a call for developing or piloting new interventions. Interventions should already have robust evidence of effectiveness beyond feasibility, acceptability, or small-scale pilot evidence, and be ready to be implemented in practice at scale. Within the application form, you'll be asked to outline the existing evidence of effectiveness for the intervention. For example, what previous research has been carried out, who was involved, and the key results of this. It's perhaps important to emphasize that we're really looking for evidence which is specific to your given interventions. For example, let's say your intervention is designed to reduce alcohol consumption. It's not enough to say that because alcohol reduction is generally proven to improve longer term health outcomes, that any intervention designed at doing this will work. We really want to see evidence that your specific intervention is effective. With that in mind, interventions don't have to have been previously implemented in practice to be eligible, but you'll need to make the case that they are ready to be implemented. Conversely, we're also open to interventions which have already been implemented in practice to some extent, but you wish to implement it in a new setting or context or with a new population, in which case you'll have to provide the rationale for this. So hopefully that's answered that question.
Thank you. Let me check. I think. Let me check if there are more chat. I can start reading some of the chat questions. Just check ones that have not been.
Yeah, I can see Sue's been very busy in answering a lot of the chat questions, so hopefully they're covered. While Pedro's looking over, Sue, are there any particular ones that you thought were interesting to highlight that you've answered already?
I think some of them were sort of very focused on their own ideas and proposals. So there were some that we've responded to and said, look, if it's specifics and there isn't really room to go into much in the chat box, then to contact us directly to talk about it, because it's sometimes quite difficult to sort of get the nuance of what you're proposing. But I think actually many of those, I think we've actually covered in the questions. I'm not sure, because they're coming in thick and fast and it's difficult to keep up. Somebody's just asked again what we mean by underserved communities, and I think we already answered the question on that. But just to reiterate, it could be an underserved community in your particular area that might not be an underserved community in another area, but please make the case for that and why that is. But in general, in very sort of top level terms, I guess, you know, the thinking was more about the communities we would typically nationally experience that they're underserved. Ethnic minorities are the LGBTQ community. The CMO has mentioned coastal and rural areas. So, you know, at the very highest level, those, but in sum, make the case for your own particular area and your particular reasoning.
No, that's very helpful, Sue. And so just, yeah, to reiterate, we won't be able to go into, you know, specific questions case by case, but hopefully this webinar and the guidelines will answer your questions. And if you feel they haven't, then feel free to email us ahead of submitting an expression of interest, as Sue had said. So just to reiterate that. Pedro.
There is some other one in the chat about, so someone that in the guidelines, we stated that drugs, medicine, and other pharmacologic treatments are excluded, but would it be okay to include an intervention that is related to increasing uptake and continuation of drug treatments that are known to be effective?
I think I can take this one, yeah. So I guess by that point in the guidelines, what we mean is we're not looking for drug trials effectively. So the intervention is not a new drug, basically. So on that point, yes, but obviously, so the intervention here is something that's going to increase uptake of drug treatment. So what we would need to know is that specific intervention, whatever it is that helps people to increase their uptake or increases adherence, that needs to be evidence-based in order to be eligible. So sort of going back to what Sanjay said, it's not necessarily enough to say the drugs themselves are effective and therefore any intervention that aims to increase adherence will work. We want to know that specific intervention is effective and is sort of ready to be implemented in practice. Hopefully that offers a bit of clarity there.
And maybe
Actually, Ollie, there's one that's come up that I know we've had before that you might want to cover was does the call cover the cost of a PhD student or postdoc to support the delivery of the project? And we do have some particular views on that, don't we?
Yeah, so the postdoc, it's postdoc researchers working on the grant is yes, that would be sort of if they're employed through the grant. PhD students, there might be a case where you have existing students who can do aspects of the work, but we're not, just to reiterate what I said earlier, it's not designed to be a PhD studentship or a postdoctoral fellowship. So we don't want this to be funding personal awards, but obviously if you're having researchers employed on the grant doing aspects of the work, that's a slightly different case. And ultimately it will be up to you to make the case for why the people who are doing the work are suitable and relevant to the work that you're proposing to do.
I guess the more general, what are we defining as older adults? Because we maybe Sue can take this one.
Yeah, so this is an interesting one, isn't it? Because this is about prevention. So we want to make sure that people are sort of, able to live healthier and longer lives. And so the intervention that you might have might enable people to do that. So I'm not putting a particular age on this, but the outcome has to be, to affect people in older age, typically sort of 60 and older. But there's also a but on this, that you might also have segments who typically, will age who have conditions that means that they age earlier, age in physiological terms earlier. So that's okay too. So I'm sorry that I'm not going to be completely sort of black and white about this, but think about the spirit of what we're trying to do here. So fundamentally, it's about interventions that will enable people to have greater well-being and better health outcomes in older age for longer.
Yeah. Okay, so there's a question here from Michelle about which I think I can take, is there any value in submitting an application that does not relate to the uplift areas, so not specifically around nutrition, obesity, smoking, alcohol, screening programs? I would say yes. So the way that uplift works is, in general, we're not going to put an application that is of lower quality through to the full stage just because it hits an uplift area. But basically, if you have a solid application which fits within the broader focus of the call, then that's also okay. That uplift is really, if everything else is pretty much even and we have to prioritize, then we will prioritize those specific areas. But I think we wouldn't put people off applying if you fit within the overall theme of the call, but you don't quite hit those specific uplift areas. The most important thing is that you have a good application that meets the criteria, and that we've provided the assessment criteria and the guidelines. If you think you hit those and you have a good case, then that's the key thing.
Yes. What about adapting an existing NHS intervention with clear evidence of effectiveness and implementing this to a population with low uptake?
Yeah, so I guess we've covered that before. So I would say that adapting an existing NHS intervention, I've just lost the question now, so hold on, with clear evidence of effectiveness and implementing this in another population is within remit. But obviously it would be there for you to make the case after reading the guidelines and looking at the application form to saying how your application fits what's being requested in the call for proposals.
I think there's about funding of arrays, but I think it falls in the same.
I guess we had a question here about if we aim to reopen, so someone has submitted, if we aim to reopen a previously successful but poor service and can demonstrate past impact and relevant to underserved groups, would that be considered a suitable evidence-based intervention for this funding call, especially if we're evaluating new outcomes in a community setting? So I guess what I would say to that is the level of existing evidence for the service is key here, and you would really need to articulate how the work being proposed and the evidence being generated is novel in some aspect, and what would help facilitate its longer term adoption. Obviously, we would have questions to understand why it was paused. Providing as much context and background as possible, not leaving any sort of lingering questions or doubts, because you have to just put your best foot forward within the application form. So it's important to note that we're not looking to simply fund the continuation of existing services that have been paused. The guidelines are quite clear that it's ineligible, that this is not about funding the continuation of services. So the guidelines provide more detail on the sort of work and research questions that we're looking to support in this call. So hopefully that helps with another quite specific query. Are there any more coming in the chat, or we can cover some of the more that have come through in the Eventbrite?
We can cover some of the Eventbrite. I think maybe Ollie, should the methodological framework be predefined, or if this is up to the investigators locally?
Yes, I think effectively we are not, again, like Sue said earlier, we're not being prescriptive, we're not predefining the sort of framework or the approach that you should be taking. Obviously, there's various frameworks for implementation research, for evaluating and implementing interventions. So it's up to you as the team to decide on the approach and the methods that are best suited to the work that you're looking to do, and to make the case that what you're looking to do aligns with the funding call. I think that's the key message, really.
So I think there is one that is fairly, I think it was already replied, but just in case. How are we defining research organizations which are not higher education institutions? Maybe Sue?
I think was that research organizations that are not
higher
education? So there's I think Sue shared the link, and there's also a link in the guidelines. So there's a list of effectively UKRI eligible research organizations. Again, that includes NHS bodies, so NHS trusts, ICBs, etc. It's quite an extensive list, so I would say I'm not going to list them all, so look at that list. It should be quite clear, but if you have any questions, then contact us. And local authorities isn't on that list, but like we said, we're open to local authorities being the lead applicant if you can make the case that you have the research infrastructure and the capacity to lead a project of this kind.
So just going through the other questions, see if there is any that is not. So if you have new questions, please.
I think we've covered pretty much everything that is coming up.
Yeah, so I guess then, barring any that pop up.
There's one question target middle, older age adults, age 50, given demographic makeup of the community.
I guess this goes back to, we won't be able to go case by case. And so effectively, I think we've covered quite a few of the overarching questions. And once again, we're happy to receive emails under the proviso that you've understood the guidelines, read the application form, re-reviewed the recording or the slides that we're going to send out after this chat. If it's in those guidelines and there's a question after that, do feel free to email. We're a small team, so there are resource requirements here that we have to consider as well. We spend a long time writing these guidelines and setting up the calls, so hopefully they're as clear as they can possibly be, but we are always open to receiving emails and questions as well. So I guess I just want to thank the team for all their help and the attendees for engaging with us and being present. There, I could see there was a lot of you in the room and a lot of chat and questions. Thank you so much. And as I said, feel free to send up follow-on questions that haven't been covered in the guidelines or this video to the grants@vivenzafoundation.org.uk email address. I think Ollie could maybe put up the slide deck with the last the last set of slides so that you can see those contact details. Apart from that, thank you for your time. We'll keep this we'll keep the Zoom meeting open for just a bit longer, just some more questions trickling through, and we can quickly answer them in the chat. But thank you very much for your time, and have a good rest of your day.
Thanks, everyone. Have a nice lunch.
Thank you. Bye.